So basically today we are going to start fluid, electrolyte and acid base balance. So basically fluid balance and electrolytes and acid base balance is very necessary to our body to maintain homeostasis, because fluid is necessary for everything, blood circulation and uh, other liquids are their body in the compartments of interstitial fluid, extracellular fluid, okay, to maintain the digestive system, because every organ need fluid. If you observe, the blood circulation is also depend upon the fluid because we need water. Okay, they are the highest percentage of water in the blood. Okay, plasma, serum. Okay, and as well as other substances like tears, bile juice, cerebrospinal fluid, okay, saliva, digestive juices, everything had a relation with the water or fluid. So that's the reason our body need fluid. Electrolytes is sodium, potassium balance is very necessary because these are the positive ions, okay. To maintain the cell function, we need electrolytes and acid base balance. So basically every after the energy development of the energy, whatever energy is developed by the cell for the function, so we have to maintain the acid base balance. So they are necessary. So let's talk about fluid, electrolyte and acid base balance. So basically people are watery creatures. More precisely, we are salt watery creatures. Though not as salt as the oceans, water, the fluid medium of the body, makes up 55 to 75% of the total body weight. Electrolytes are the positive and negative ions present in body fluids. In previous chapters, we call this salts or in some cases trace elements. Many of these ions are minerals. They are already familiar. These each have specific function in body fluids, and some of them are also involved in the maintenance of the normal pH of the body fluid. So basically, our body weight to 55 to 75% of the body weight is fluid. So this is the only one answer which will give the necessary thinking to us to maintain the fluid balance, because now we have to drink the water 3 to 4 or 5 liters according to your body weight. Okay, and we doesn't allow to drink that much amount of fluid. So basically, it will decrease all the basic functions of the body. Okay, so let's talk about compartments. So basically, already in the cell, before entering the cell, we have three compartments: the fluid within the cell, the fluid outside the cell, the fluid in the blood, the fluid in the lymph. Okay, so the movement of fluid occurs because they are semi-permeable membrane. They allow some amount of fluid exchanges. Okay, so likewise, if uh, some neighbor is there in your house, so what we do, we will exchange some things like salt, sugar, water, and some necessary things in inter exchange will occur. So likewise in the body also, the cells, the other related things, vessels or lymphatic channels will exchange the fluids. Okay. You can see that's intracellular fluid, the fluid within the cell. Okay. Extracellular fluid, the fluid outside the cell. Okay. And the fluid within the tissue, that is called interstitial fluid, and the fluid in the blood capillaries or blood vessels, that is called plasma. So wherever you see, we see that fluid in this area. So you have to know about that interstitial fluid, interstellar fluid, lymphatic fluid, and extracellular fluid. These are very important things. So how much amount of water we have to take and how much amount of water output is there? Okay, let's talk about that. So most of the water the body requires comes from the ingestions of liquid. This amount averages 1600 ml per day. The food we eat also contain water. Even food we think of as some water dry, such as bread, contains significant amount of water. The daily water total from food average 700 ml. The last source of water about 200 ml per day is the metabolic water that is produced of cell respiration. The total intake of water per day, therefore, is 2500 ml or 2.5 liters. Most of the, so basically, we need 1600 ml per day. Average, minimum you have to drink that. So whatever food you eat, that also have water like vegetables, fruits, even dry food like bread also have water, and our body also produce after cell respiration 200 ml of water. So this means that total 2.5 liters of fluid is we are intaking. So basically we need 2.5 liters. If we maintain this level of uh, water intake or fluid intake, our body will work balanced. But daily we work, daily we travel, daily uh, we have lots of work. So in that process, the circulation will happen fastly and the sweating will come. So that will increase the your intake process. Okay, you need to take extra 500 ml water. So your body need minimum average 3 liters of water per day. Naturally, any increase, most of the water lost from the body is the form of urine produced by the kidney. This average 1500 ml per day, about 500 ml per day is the loss in the form of sweat. Another 300 ml per day in the form of water vapor in exhale air, and another 200 ml per day is lost in feces. The total output of water is the about 200 ml per day. So whatever amount we are taking, we are also excreting that. How? By urination 1500 ml per day, and form of sweat 500 ml per day. In the form of exhale, we are exhaling uh, gases, we are also exhaling some amount of liquid. Okay, and from the feces motion we exhale 200 ml of water. So if you calculate, we will exhale 300 sorry, 2 liters 500 ml per day. Okay, so here also the diagram is given, very important. Naturally, any increase in water output must be compensated for by an increase in intake. Someone who exercises strenuously, for example, may lose 1 to 2 liters of water in sweat and must replace the water by drinking more fluid. In a healthy individual, water intakes equal water output, even though the amounts of each may vary greatly from the averages just mentioned. So this is the average, minimum average. It is also depend upon your work, your designation, your daily uh, activities is also dependable on the fluid intake and outtake. If the output is more, you have to take input, you have to increase your input. Okay, how are our body maintain input and output? This is very, very important. Okay, the hypothalamus. The hypothalamus in the brain contains osmoreceptors that detect changes in the osmolarity of body fluids. Osmolarity is the concentration of dissolved materials present in fluid. Dehydration raises the osmolarity of the blood. There is a less water in proportion of amount of dissolved materials. Another way to express this is to simply say that the blood is now in more concentrated solution. When dehydrated, we feel the sensation of thirst characterized by dryness of the mouth and throat. As less saliva is produced, thirst is an uncomfortable sensation and we drink fluids to relieve it. The water we drink is readily absorbed by the mucus of the stomach and small intestine and has the effect of decreasing the osmolarity of the blood. In other words, we can say that the water we just drank is causing the blood is to become a more dilute solution and serum osmolarity returns to normal. The sensation of thirst diminishes. So basically, hypothalamus have osmoreceptors here clearly explained that liquidity part of the blood is maintained. If the liquid portion is decreased, so cells will more thickness will come. Okay, thickness is decreased, thickness will come. So the osmolarity osmoreceptors will detect that and it will advise the mouth, stomach, the mucus will dry and you will get the thirst. Your throat will be become dry. So what will happen? You will drink water. You will drink water more and more. So then your thirst will decrease and the water is absorbed in the blood and the osmolarity maintained. Okay. So this is the process. Hypothalamus receptor will detect. The hypothalamus is also individual in water balance because of the production of antidiuretic hormone, which is stored in the posterior pituitary gland. In a state of dehydration, the hypothalamus stimulates the release of ADH from the posterior pituitary antidiuretic hormone that increase the reabsorption of water by the kidney tubules. Water is returned to the blood to preserve blood volume and urine output decreases. And here second problem is output also you have to be decrease if the you are not taking input. Okay, you are not taking input, water input. So basically what hypothalamus do, it will also activate pituitary gland. Pituitary gland, posterior pituitary gland. Posterior pituitary gland have antidiuretic hormone, which will release from the posterior pituitary gland. It will activate the tubules of the kidney to reabsorb the water, not to exhale all the amount of fluid water from the body. You have to reabsorb that. Then what will happen? The osmolarity of the blood will maintained. Then the output also decrease. Okay. And first is osmoreceptors from the hypothalamus, and second is pituitary gland, posterior pituitary gland, and ADH. So, because in the pituitary tumor, the ADH is increased or decreased. So, if the ADH is decreased, so what will happen? If the patient have more urine output. If the ADH is increased, so what will happen? The patient have less output. Okay, so you have to think about pituitary gland also. So there is the reason in the kidney damage, kidneys disease. So what will happen? The patient have less output. It is due to the damage of glomerular filtration. Okay, and second, the patient, if the patient is having more problem. So basically here two things have happened. The third thing is that the hormone aldosterone is also helping, okay, from the adrenal cortex, okay, to regulate water output. Aldosterone increases the reabsorption of sodium ions by the kidney tubules and water from the renal filtration. Follow the sodium back to the blood. Aldosterone is secreted when the sodium ion concentration of the blood decreases or whenever there is significant decrease in the blood pressure. So already we studied yesterday about aldosterone. Okay. Several other factors may also contribute to water loss. So other things also contribute for water loss, that is excessive sweating, hemorrhage, diarrhea, vomiting, burns, fever. So in this process, what will happen? The water is replaceable. We have to replace the water. We have to take fluid, electrolyte, water intake, fruit juice, everything, anything. Okay. So it may be required IV also. That's the reason in the hospital they first see the input and output chart. Okay, because fluid balance is very important in allopathy. To maintain the sodium and potassium is very important in the prospecting. So other things also we studied in previous classes. So here 2 to 3 things we have to remember, that hypothalamus and pituitary gland, aldosterone, and we have PTH also. I think here is ANP is also is there. Atrial natriuretic peptide. Okay, it is also very important. Okay, so basically these 4 things will regulate the output and input. Next, we will talk about electrolytes. Sorry. So here we have to know about electrolytes. So I think understood input, output. So which are the things are regulating the output mechanism? So okay. So here how we'll talk about electrolytes. So electrolytes, what electrolytes do? Basically, electrolytes are the positive and negative ions. Okay. They are salt, they are acid, they are base. Okay. So for proper uh, I think we will this is communication, way of communication of not organs, between nerves and muscles, mostly nerves and muscles. Okay, this is the communication things which you required. So if you are in resting position, you doesn't need any electricity current. When you are working, you are doing any work, you need energy. So along with energy, we need communication between nerves and muscles. So those, if they are communicating, they need positive ions. If they are resting, we need negative ions. So it may be balanced. Okay, so understood like that. So basically, what are those? They are the positive ions, they are the negative ions. Positive ions like sodium, potassium, calcium, magnesium, ferrous, hydrogen. They're the positive ions in the body. They give positive charge. If you want to work, you need these things. You are resting, you need negative ions. Chloride, sodium bicarbonate, uh, yes, sulfate, phosphate, and protein ions. These are the negative ions. Anions, we will call anions. Cations, positive ions, anion, negative ions. So basically, if the cations are decreased, so we only have anions. Anions are balanced. So basically, the cell is in resting position always. So we need to increase all the positive ions like potassium, sodium. We need salts. We need the potassium will come from so the sodium will come from the salts, the potassium from the food and fruits, etc. We'll know about that. Okay. Electrolytes in body fluids. The 3 principal fluids in the body are intracellular fluid, extracellular fluid, and tissue fluid. So we have 3 fluids. It may be in the cell, it may be outside the cell, it may be uh, blood vessel. So 3 fluids, 3 areas where the fluid is there. Okay. So we need electrolyte balance. The major difference may be summarized as the following. In intracellular fluid, the most abundant is potassium and sulfate. And protein ions are also abundant. In both tissue fluid and plasma, most abundant potassium, chloride, protein ions. So basically, we need balance. Potassium and sulfate is present inside the cell. Outside the cell, extracellular fluid, or we can tell that in the tissue fluid, we have sodium more and chloride more. Balance, negative and positive balance. If the sodium comes inside the cell, that will becomes the increase the uh, energy levels of the cell. It will become positive ions. Sodium potassium are more, sodium are more, so it will become positive. Okay, so that's why the cell will get the communication. Mostly muscular and nervous system need this body positive ions. Okay, so this is very important to have understood. So we will know electrolytes will come from the food materials, sodium, salt, and fruits. Everything have uh, sodium and potassium. So basically, the kidney is very important here because the reabsorption will occurs at the level of tubular. We have the reabsorption. Yesterday we talked about that. So reabsorption will happen at the kidney. So we need everything we need to know about that. Okay. So yesterday class is also important. So here today the summary, like summary, you are knowing that. Okay. So basically, here in water intake, water output, water the regulation, and electrolytes are important to maintain the body fluids and connection between the cells, between the muscular system, between the nervous system. Okay, so these are the very important things we have to understand. So if anyone have any doubt, we will discuss. We'll discuss acid base balance tomorrow. Okay.